Canada has lost its measles elimination status. That is the news today from the Public Health Agency of Canada. Since the fall of last year, there have been more than 5,000 measles cases in 9 provinces and 1 territory. The Pan American Health Organization, which is part of the World Health Organization, made the decision on Canada's status today. They say Canada can get its elimination status back, but only once the current outbreak is interrupted for at least 12 months. So here to talk more about that is Dr. Brian Conway, the medical director for the Vancouver Infectious Diseases Centre. Dr. Conway, a very good afternoon to you.
Good afternoon, Gloria.
Thank you so much for being here. Again, hearing that news, what goes through your mind? How significant is the loss of this status?
Well, it's very disappointing. It was unnecessary. It's something that could have been avoided. We held it since 1998. And what it means is that people traveling to Canada need to be careful because they could get the measles. And I think that's really the take-home message that the Pan American Health Organization is trying to tell us is people coming to Canada are at risk of measles.
Just how important are these international classifications, though, like measles elimination status? How far known is this?
Well, I'm not, where it will play is, for instance, if you travel to various other parts of the world, you go to Africa, you go to Asia, you go to a travel clinic, and you're told what you need to take in terms of medicines or vaccines as a preventative. Now, it may well be that if you go to a travel clinic in Australia, you say, I want to go to Canada, they say, well, make sure that you're protected against the measles before you go. It's sort of that's where it will potentially play. And in terms of our day-to-day lives, it really is telling us that our vaccination rates have fallen so low that this is the current state of affairs, and we need to address it.
Well, I know we have had conversations about this before when you have been a guest on this show. How did we get here? I mean, how long have you seen this coming?
Well, a few years as the vaccination rates dropped from 90 to 80 to 70 and even to 50% in some particular parts of our province, parts of Canada, you know that there are now many people who are at risk of getting measles, and you try to intervene, but in the context of a lot of vaccine misinformation and people calling all vaccines too new and untested, where measles, it is quite the opposite. It's been around for a couple of generations now. It's neither new nor untested, and people generalize and they make decisions, and they don't make these decisions based on all available information, and that's unfortunate.
Right. Okay. So besides declining vaccination rates, are there other factors that can contribute to this loss of our status?
No, that's all. It's lower vaccination rates. So what happens is forever, even while we've had this coveted status, people have gone abroad, they've gotten infected, they come home with the measles. We identify the case, we isolate it, we reduce the risk of transmission. In the context of high community-based vaccination rates, there is no ongoing transmission. What's different in 2025 is someone comes into Canada with the measles, and there are enough people around who aren't protected by vaccination that there is onward transmission, and onward transmission from them. And this community-based transmission is the criteria that is used to say that, well, this is not a country that has adequately eliminated the measles, and this status is not appropriate for Canada.
Well, we see the latest numbers. As of November 1st, it seems Alberta and Ontario have the most cases, in cases in the thousands. The latest number from Ontario, 2,393 cases. From Alberta, 1,946 cases. BC has the third highest number, but we're at 336 cases. So what can you tell us about how and where it's spreading in this province?
So when you report these numbers, there's two things we should consider. The first is, what is the total number of cases over the year? And then what are the number of active cases? And over the past week or two, BC has led in terms of the number of active cases, with somewhere between 7 and 10 new active cases in the northeast part of the province, linked to the lowest vaccination rate in that region within our province. So the numbers are really not something that we would have ever expected to see, looking at the very low numbers over the previous many years. But what is problematic is the ongoing transmission and the number of active cases. And for that, right now, it's in northeastern British Columbia that we need to pay attention.
I see. Okay, and what are some of the reasons behind what's going on with measles vaccine hesitancy here?
People are generalizing their vaccine hesitancy from, say, COVID, that they felt was very new and untested, to all vaccines. And we're forgetting the amazing good news story that vaccination represents. Over the past 2 generations, diseases like smallpox have eliminated. None of us have seen polio. Maternal to fetal transmission of hepatitis B virtually eliminated. Haemophilus influenza, meningitis in children eliminated, or virtually so, because of vaccination. So there's an overarching good news story that isn't being told. And for that, we need to take responsibility and find a way of telling that story. And then in that context, addressing vaccine hesitancy, disease by disease, vaccine by vaccine, and getting the vaccination rates up that way.
I see. Is this just a Canada issue? Are you seeing this in other countries around the world?
Well, many other countries, and unfortunately our neighbors to the south, seem to have turned away from vaccines as a society. And people who have any element of vaccine hesitancy are saying, well, if the Americans think that, they must be right. Well, they are often basing their conclusions on incorrect information, and we need to fix that. So it's worldwide, but it's being largely driven by misinformation in the social media and institutional misinformation from the United States right now.
How do you counter that misinformation? I mean, what should you be doing here in British Columbia, Canadian officials, health workers? How do you reach people who are getting the wrong message, who are unsure about the vaccine?
Well, I'm not a social media expert. There must be a spiffy way of getting the good news story out, of showing how little disease of various kinds that exist, things we can vaccinate against. So that's part one, telling the good news story. Part two is telling people, look, we know that there are rare side effects of vaccines. Let's not deny that. And most of us have never denied it. But the risk of natural infection and its consequences dwarfs the risks of any of the rare side effects of vaccines. So that's how we should be making our decisions. And lastly, let's encourage people. You have vaccine hesitancy, you're not sure, ask someone, get into a conversation with the knowledge that people like me will never force you to get vaccinated, but we'd love to have the opportunity to discuss vaccine opportunities available to you in a non-judgmental, back and forth way, and make sure that you're deciding for yourself based on facts and not myths that are promoted by social media.
Well, and here we are, close to 5,000 cases across Canada right now. What is your level of concern about the spread of measles?
Well, I'm greatly concerned right now because we're seeing continued outbreaks, one in northeastern British Columbia that I've mentioned. But this to me, it makes it urgent for us to have these discussions about measles vaccine and how it has really stood the test of time and is one of the most effective interventions we have against a disease that's usually mild but can cause pneumonia, brain infections, and can potentially kill you. So I'm hopeful that if we get that kind of discussion going, not in an oppositional way, but in a collegial way, and make it clear that I and people like me, we're not hiding information. We just want to have the opportunity to talk to you. So that makes me optimistic that I hope that'll happen.
I really appreciate your time today, Dr. Conway. Thank you.
Thank you, Gloria.
Dr. Brian Conway is the medical director for the Vancouver Infectious Diseases Centre.